Now there are certain situations in this skill, maintaining patient confidentiality, which you should know. These are ethics. Uh, the one thing you should know that your personal safety is of paramount importance. If you think that it is at risk, you should inform your senior colleague like consultant and seek advice and support from the hospital security team, okay, in order to minimize the potential danger. Second thing, maintaining patient confidentiality is a cornerstone of the duties of the doctor. So because the patient reveal very minute and minor things and important details, fine details about their health, so doctor have to keep them confidential. Except it doesn't mean that only the doctor will know. Other members of the healthcare team, social care team, and the person's nurse, allied health professionals, they all, because they are involved in the patient care, so they will all know about the patient condition, okay, but not other persons. And now there are certain situations in which patient confidentiality may be breached, okay. So you should know all of these points because these may be asked by the examiner in the exam. If there is notification of certain infectious diseases, births and death registration, and in legal cases if the patient information is requested by a judge, okay, then also. And in such situations only information about the patient which is relevant to the case needs to be disclosed, okay. The court should not ask about the patient's relatives or other contacts if not relevant. It is not necessary for the doctor to disclose patient information to the police officer or solicitor unless it is required by law or for purposes of greater public interest, or in situation where another individual is at risk of serious harm due to the patient's conditions or behavior, okay, or any serious communicable disease, then doctor may breach confidentiality, and the patient consent, express consent should be obtained if possible before disclosure, okay. And patient identity should be anonymized if possible. So these are certain situations in which the doctor can breach this confidentiality. And legally something you should know more, that it is permissible for a doctor to disclose information about a patient without their consent if the disclosures would be likely to help in prevention, detection or prosecution of serious crime, okay. Such a disclosure is justified if you believe that other people are still at risk from the patient or if she possesses a weapon, okay. However, you should not make efforts to inform the patient about this if it is practicable and safe to do so. And additionally, if the healthcare professional has reason to believe that patient presents a threat to same victim, another member of the public or staff at the hospital, this should be reported to the police, okay, regardless of whether or not you know the identity of the victim of the previous crime. Please like, share and subscribe my YouTube channel for more videos. Thank you.